Hi, y'all. We've got this is another talk about politics, and one of the important issues across the state for me is addiction. I don't know very many family members. Very many people in West Virginia that's not been impacted by addiction, and so we are brought in Brooke Parker tonight. She is, works with a lot of folks, and they're doing a lot of things, and even as a candidate and even, being part of my community, we're always learning. And I've talked to a lot of people that have been working on these issues, but Brooke has, taught me a lot of things too. So we're just going to have a back and forth conversation about what's going on with our state, especially with medical assisted therapy, and not even calling it drug replacement therapy. That she taught me, because it kind of stigmatized people in addiction. And so, Brooke, let's just talk about what's going on. And, a big part of my platform is helping end addiction in our state. So what are you guys doing within your program? Can you explain what you're doing? And, just let's have a conversation about it. I can't hear you.
There we are. Sorry. Thanks for having me on. I think it's really amazing that candidates are, that this is something that you're willing to talk about, because I know how important it is to you. So thank you.
Of course.
I'm a social worker. I'm from Kanawha County, and I work with a group here in Charleston called Solutions Oriented Addiction Response, and we're the largest harm reduction program in the state at this point, and we are completely volunteer. We're community led, so we're grassroots, and we're entirely self-funded at this point, but we do street outreach to people who use drugs. So we're right there with people. So I think what we're able to see, I think being down there with people, exactly where they're at, like meeting people where they're at, gives us a little bit of a different perspective.
So let's explain to folks exactly what harm reduction is.
Yeah. So most of the time, I think when people hear the words harm reduction, they immediately think syringes. And harm reduction syringe service programs are a large part of harm reduction, but harm reduction is so much more than that. So generally, a harm reduction program is run through a health department, like county health department, and it's a range of services from medical care and wound care to testing for HIV, hepatitis, STDs, kind of everything. It's access to medication-assisted treatment, counseling. IOP is a big one. Harm reduction programs can help people stay in compliance with whatever court orders they need to be following. If they're out on some kind of release, then harm reduction programs really help people stay in compliance with that. And it's education about safer use practices and how to prevent the spread of disease, how to prevent complications from using IV drugs. And it's the biggest thing about harm reduction that I think is misunderstood is when people hear it, they think that it's like enabling people to use more, or it's enabling people to use more often, or sometimes people think that it's it's even increasing overdoses because people can use more often, whatever the understanding is. But in reality, harm reduction programs provide a point of contact and a connection for people that don't otherwise have any contact with providers, with people in recovery, people that work in recovery. And so more than anything, it provides a place for people to build connections and relationships and trust. So then when they do need help and they decide that they're ready to come into recovery, whatever that's going to look like, that's what harm reduction does.
Mm-hmm. And, part of this campaign is me as a candidate. I want to make sure that we offer more solutions around the state to help end this crisis. Mm-hmm. And I think the first step for all of us is ending the stigma behind addiction. And, the language is changing all the time. You taught me that. I tell people all the time that there's 80-year-old ladies that trusted their medical provider, and they were overprescribed opioids, and they ended up being addicted. And addiction does not discriminate. So, I think that we need to reach in as West Virginians and quit stigmatizing. It's important for people to get into to recovery systems is just as important as insulin. It is a disease. So let's talk about that. Because I know people that won't even go into a recovery system because they're afraid that they'll be stigmatized. I've heard that way too much. So let's talk about that stigma, and let's talk about the language as allies that we should be using, so people can, they feel safe, they can go into safe spaces, and they feel like that they can get into good recovery programs.
That's a great way to put that. I know even for me, I'm a person in long-term recovery. I came to recovery in 2007, and I know I'm a social worker, and I was lucky to be able to keep my career. I got back into school, and I know even just, that's my cats in the background. I'm really sorry.
The cats are doing the live stream too. They want to be a part of it.
They absolutely are. I know even the fear that I've faced as a person in long-term recovery, or a person with long-term sobriety, the fear that I've confronted, hoping that people don't find out that I'm in recovery as a social worker, just as a person in my community, has been so intense. And it's taken a lot of time for me to be able to come out with some confidence and say, I am a person in long-term recovery, and I really believe in this. The stigma is so powerful. It truly, truly is. So when we talk about stigma and what it does to people, the first way we can kind of think about it is the language that we use, like you had referenced. And so we like to call it people first language or person first language, where really all it's doing is taking the medical diagnosis and putting it as secondary to the person. So you're seeing this as a person instead of I'm more than an addict. I'm more than an alcoholic. I'm a person in long-term recovery, right? And so when we talk about people who use drugs, we say people who use drugs instead of addict or alcoholic, or one of the many other terrible names that we call people who use drugs, because really it's important to remember that they're more than just their addiction. They're more than just that. They're more than just that problem. And so we think that by changing language, then we can see people as a whole person with some things that need improving, some things that need help. They need connection, instead of just a sick person and there's no hope. Does that make sense?
Right.
So right. Even simple words like saying clean and dirty, like saying, right. That someone is clean or they're not clean, it really insinuates that if they're not, then they're dirty. And so even just the way we talk about that is really hard. We don't ever want, when we talk about it, then it's so important to put that person first.
Mm-hmm. And you've heard me talk, and we've had this part of our conversations is long-term recovery centers and across the state, and they're needed. And one of my biggest frustrations with medical assisted therapy is it seems like the main focus of a lot of politicians, and they don't invest in long-term recovery systems because they're funded by the pharmaceutical industry, and their main focus is to take medical assisted therapy and take drugs to replace drugs. And I know that it plays a role. So you taught me some stuff that I wanted to bring out to the public about medical assisted therapy. Let's talk about the goods and the bads outside of that, because we know that we do need long-term recovery systems on every corner of this state, but we also need to make sure that everybody has a path to recovery. So let's not only talk about the stigma, but let's bridge the barriers between those two, and people can have a better understanding about medical assisted therapy.
Great. Yeah. So medication assisted treatment is, it's a part of the range of services provided in harm reduction programs. And I think in every community at this point, there's a medication assisted treatment clinic, where Suboxone is normally, that's the one that people hear about the most, I think, anymore. Methadone isn't used that much anymore. And I think methadone is an interesting drug in itself, and the way it was used is, when I think of medication assisted treatment, I think of Suboxone. That's been that's been the tool I think we've been able to use the best to help people overcome opioid addiction in particular. So I think the first piece of stigma that I think is really, really important to get over is just this idea that abstinence is based on being free of medication, and also this like underlying belief that, guys, I'm sorry, my cat.
We're talking about deep issues, so it brings in
this whole being free of medication, like that's very, very based in stigma and misunderstanding. And the other piece to it too is you referenced it, that there's many paths to recovery. That's an idea that harm reduction really works to promote, because one person and one entity can't say what's right for all of these different people. It's because it's not in their experience. Everyone walks a different path. Then I really believe in building up people to be able to decide what's best for them. And sometimes, like medication assisted treatment was something I never had to even think about. My drug use didn't involve anything that would have required that. So I've had to do a lot of my own research and talk to a lot of people about what medication-assisted treatment has been for them, so that I can learn from their perspective. It's not something that's in my own experience. So, right, like it's really making sure that we know that people are the experts on their own problem, and so medication-assisted treatment is just one of those options. I think the idea too that complete abstinence is the only thing that's recovery is something that's it's really hard for people to swallow. But I think when we talk about sobriety or recovery, most people immediately think complete abstinence from everything. And I think with addiction, especially what addiction looks like in our state right now, it's really important to remember that even like incremental progress or even a little bit of improvement for someone is a huge success. The drugs that people are withdrawing from and trying to abstain from, it's a lot more complicated than it was 10 years or 20 years ago. And so making sure that we can adapt to how the face of addiction is changing, especially in our state, is a piece of that.
Well, I've seen on a firsthand basis, we don't have like even enough long-term recovery centers available to people. And I've heard and seen so many people, you have that window within 2 to 3 days where people want, if they decide that they are ready to go into treatment and then they don't have access to a bed, it's Suboxone and things like that, then, I can see that that's going to help. So, also too, when I've seen a lot of people, they go in for 30 days to detox and then they have not had the advantage of Suboxone or go through, to a long-term recovery center. They're put back in the same environment, and it increased the drug overdose deaths in this country because they think their tolerance is like it was before and they end up overdosing. And, we do lead in drug overdose deaths. And it's good that we're having conversations like this, because I say it all the time. And you talk about people being in charge of making their own decisions for themselves. That's what I want to do as a representative. Absolutely. I want to make sure, because I'm not the end all be all. I don't have the answers. I have never, suffered with this type of addiction. So I can't say how it impacts me personally, except for, how my family members and friends have been impacted. And so as representatives, we should be hosting roundtables and bring people from our communities and across our states and federal representatives across the country, bringing in people like you to help write legislation that impacts them directly, because, who better to serve us than us? And we cannot expect people that are not in touch with our struggles to even understand what our struggles are and make decisions for us. Yes. So it's so important to me to make sure that we put the government back into the hands of the people. And that's why we're having this conversation tonight, because when, you and I met and we were talking about this topic, and even though I had spent a large amount of time, you still taught me something. And that really solidifies that we need to quit putting these people on a pedestal, because they're talking to corporations and lobbyists, and special interest groups are writing legislation that impacts our daily lives.
Mm-hmm.
And, we look at their funders, and, the pharmaceutical industry plays a big role in this in creating the problem, but also people do need the tools to get the treatment that they need. And you opened my eyes to that.
Absolutely do. Thank you. And I know too, especially with medication-assisted treatment, we're still pretty early in tackling this problem. And so I think it's fair to say there are a lot of problems with medication-assisted treatment, and there's a lot that I would love to change about it. There's a lot, particularly in West Virginia, that I would love to change about it. And I think that there's a lot of room if we get the right people having those conversations. It's people with lived experience, and it's people that are in the middle of the problem right now. It's people in recovery, and it's people that work with people in recovery and allies. But legislators making decisions that aren't informed, I think, is one of the most damaging things that happens to us, because it's not people that they haven't walked in our shoes. They don't know what it's like. So being able to listen and being able to talk about it, I think, is one of the most powerful things that we can do as a community, as a state, to be able to work on stigma, on the overdose crisis, on the addiction crisis, and just on healing our own communities.
Agreed. And, even Suboxone, I've heard some people say it was harder for me to come off Suboxone than it was heroin. And so explain that, because we hear that. I heard that so much, and I want people to hear highlight the differences and why that happens.
I get that a lot too. I think, I actually called a friend today, that I knew she had used Suboxone, as part of her path to recovery. And so I asked her that question today just to kind of get another opinion about it. And what I understand about it is that seems to be very much, it's based a little more in stigma. Suboxone can be abused. I'm not going to say it can't be. It absolutely can be abused. The method of delivery can have something to do with that. The dose has something to do with that. A person's just individual biology, their chemical makeup. There's so many factors that play into that. To counter it, I've also known plenty of people that have said, I was on Suboxone and I tapered down according to what, I worked out with my doctor, and it was fine. So I think that it's such an individualized problem. And so it's really easy to say that, to make like blanket statements and say it's harder to come off of than heroin is. And that might be true for a lot of people, but it's not true for everyone. And when we can hold doctors accountable, and we can hold clinics responsible, and we can make sure that there's some oversight in how these programs are run, I think that's where we can really start to win and make sure that people are getting the individualized treatment that they need, so we don't have people suffering like that. Because when you suffer like that, you go back to using. There's kind of no way around that. It's too much pain to carry.
Right. And, I've even seen within some of these systems too. And I think that we do need more professionals running these programs in a lot of ways too, because we have so many different ones popping up on every corner, and people are so desperate, that I know Suboxone has also been stolen on the street because people are desperate to get treatment. But that's why it's important to make sure that we have true professionals and folks like you that are working within these systems to make sure that people do get adequate treatment, just like you said. So, even in the path of learning, I also see, there's things that could be improved greatly. And like you said, just people being in charge of their own treatment is very, very important.
And having doctors that aren't driven by profit, having doctors that aren't driven by profit, and that are committed to helping people find whatever sobriety is going to be right for them. Some people will need to stay on Suboxone for a long time, and some people won't need to. And some people can use it as a bridge to finding whatever sobriety can look like. And sometimes Suboxone can be used to help them overcome like physical pain, to help keep them sober and off of using opiates again. I talked to someone today that they said that's what had helped them maintain their sobriety. They had encountered a lot of physical pain and physical problems a couple of years into their sobriety, abstinence-based sobriety, and they ended up on a teeny tiny dose of Suboxone, and it's helped them maintain their sober life. Without it, they would have relapsed on opioids. There's no way around that either. So I think it's also really important too to understand. I've heard a lot of people say Suboxone can be abused. There's a lot of reasons why it's sold on the streets. There's a lot of reasons why it can be really hard to get, even if you really want to be in treatment. Suboxone can be very difficult to get, and programs can be very hard to comply with. And none of them are the same. A lot of them have different requirements. So I think that's something that could really be improved upon too. But Suboxone, medication-assisted treatment in general, but particularly Suboxone, it regulates the levels of dopamine in the brain. That's what it does. Those levels are altered by the chronic use of whatever, an opiate and other drugs. But Suboxone works to bring that person's their individual dopamine level back to level, like a normal level, and then it's a blocker for opioid receptors, so that if you do end up using, then it doesn't affect you the same way that it would. It's absolutely abused. It can be poorly prescribed, and if it's not a cure-all either. I think that's a really important piece of it that a lot of clinics that I've seen really miss out on, is this opportunity to really treat someone as a whole person and not just, here's your script, I'll see you tomorrow. That's an opportunity to bring in all the modalities of treatment that can really help support a person in finding sobriety. And that's so many things. That's behavioral health. That's there's just so many things that can be combined with it. Effective therapy and peer recovery support. We've got these amazing peer recovery coach programs in the state now that are just they're building people up so much, and they're really helping at the community level. But just like you can't just give a medication. It doesn't work like that with addiction.
Right. Right. And we have seen the abuses of those systems, and I've seen people that were in recovery and even that were on Suboxone, and, that went into these pain clinics that we even had out in the cold fields for a while, that there was a lot of misuse. And I learned from people in addiction, even to change, and so it was stigmatized with people. Let me go back. People that were looking for effective pain management. Were stigmatized and called addicts. And there's even my mom, she's got rheumatoid arthritis, and she doesn't want to take her medicine because she's afraid of getting addicted now. Mm-hmm. So people that are trying to even get into managing their pains and going to these pain clinics, there's so many things in these systems that haven't worked. But I was proud to see and talk to someone like you working in systems that do work. And the big issue for me is us collectively sitting down and solving these problems and making sure that there's enough state and federal funding to implement these systems, instead of people that are beholden just to the pharmaceutical industry. So, I really love having these conversations, and I love bringing them to the public like this too, because we all can learn right now, because we are dealing with one of the we are leading with drug overdose deaths in the country. And if we just keep on stigmatizing, and if we have tunnel vision, then these problems are going to continue. So we have to continue to work together as neighbors and working in our communities, as well as letting our representatives know that the people in the front lines of our communities are solving their problems, and we need to be heard. And it's about making sure that everybody has a seat at the table. We are not going to end this crisis if we have people at the top that are not listening to the people in the communities. They're dealing with it day in and day out.
That's absolutely right. It absolutely is. I know that I learned stuff all the time too, and I didn't realize, I learned just recently that West Virginia is one of the very few states in the country that only allows name brand Suboxone to be sold and prescribed. The majority of other states allow for generic, so it's cheaper, it's easier to get, but it's also easier to access. And we all know, I know even medications that I've had to take, I always get a generic no matter what, because the price difference is it's insane, right? So Suboxone is one of those very, very few drugs in West Virginia that cannot be substituted for a generic. And I think that if we were to look at this from a policy level, then that would be something that we could really tackle to make sure that it's accessible and it's not profit driven, to make sure that people are getting the treatment that they need and that Suboxone can be used in a way to help people and not just, like those cash only clinics and the ones you got to show up to every day with a handful of cash. Those are, I think we could really do a lot of good work to regulate those more and make sure that that's not what's happening. It's meant to help, but it's abused it's abused in a lot of different ways, I guess. We've learned some really great lessons from, pharmaceutical companies and overprescribing opioids in our state. So even just applying those lessons, how did we rein them back in, and how did we call them to the table, and how did we hold them accountable for what they've done? I think that could very easily be done on a really small scale with Suboxone to make sure that we are holding these people accountable and it's not being we're not being exploited. I know that that's a huge part of your campaign, and I love that.
Well, that's why this is another big reason why I advocate, there's several reasons I advocate for Medicare for all, but this is another big reason, because I've seen so many people that want to get into recovery and they can't afford those cash clinics. They don't have insurance to get into a recovery center. And we've seen more centers that are community based, and they rely on grants and state and federal funding to survive. And, they have limited resources. And they have limited spots for people to get into. And if we had a universal healthcare system, then we wouldn't have to worry about that no more. And people could get into the recovery systems that they need. And, it's just so discouraging to me. It's like we are always last, and we've been treated like collateral damage in so many ways. Not only with industry, but even with this crisis. And, it's time for West Virginians to stand up and say, not only do we deserve, but we demand that we have the systems in place in our communities and across our state to help us grow. Mm-hmm. And one of the first and foremost problems in this state prior to COVID-19 is this crisis. And it should be on every incumbent's mind. And they should be sitting down with everybody that is working within these systems across the state and making sure that we do solve these problems. And it's I lost my little brother this year because he was addicted. And, something like Medicare for all and a good recovery system could have probably saved his life. And I know that, every West Virginian is impacted one way or another, whether that you're going through recovery or you're dealing with this crisis, yourself, or if it's with a family member or friend, and making sure that we have good mental health programs in place. Mm-hmm. And also making sure that people have a path back into society and they can get a good job and they're not stigmatized and they're not, social programs like SNAP benefits are not taken away from them, so they can, get back into society and can grow, and that be part of the recovery system. It's just, there's so many things, and it's just so discouraging. And this is one of the big reasons, outside of me coming where I come from and being abused by industry and burying so many family members to industry and watching West Virginians be abused, is this. A lot of places, in poor communities and extractive communities, it seems like we suffer the most with this crisis. And, we have built so much for America. The Industrial Revolution was built on the backs of West Virginians. We don't deserve this. We're even stigmatized just because we live in this state that we don't have teeth and shoes and brains. Not that, not having teeth is bad. It's just we are devalued so we can be treated like we are. And I can't thank you enough for working so hard in our communities to help solve these problems and opening my eyes to different ways to a path to recovery, because you were telling me things, and I've talked to a lot of people that I didn't even know about. And being a prospective potential representative, I thank you, because these are the things that I need to know. So if I do go to Washington, I can take people like you with me so we can end this crisis.
I appreciate you. I've lobbied a lot of legislators, and very few listen. So I appreciate you more than you know.
Well, I know how it is too. That's why it's so important to me to make sure that West Virginians and people across the country have a voice and have a seat at the table in DC. I can remember years ago lobbying, and the representatives or staffers looking at me with, just staring at me like, why how can I help you if your state won't help you? If your state representatives are not going to help you, how can I help you? And that started turning my wheels and thinking about running for office, because they're right. I mean, if our representatives are not going to stand up for us, and they've proven, and it's going on deaf ears, if we rally, if we beg, we do whatever, cut our legs off, they're not going to hear us. If they ain't going to do their jobs, it's time to take them. And that's why, that's why I'm here right now. I mean, it's not that my dream was to become a politician. I hate even being on this live stream right now. I'm camera shy. It's important because people are literally dying and starving in this state.
Absolutely. You're absolutely right.
Well, is there anything else that you want to talk about that people just don't hear enough? I mean, we have a large following. This is going out on Twitter, YouTube, Facebook. Just not Facebook Live. What, talking to people across the country, and then, because it impacts people not just in West Virginia, but across the country. If there's anything else that you want to talk about working within these systems that people need to know.
I think particularly with people who use drugs, then stigma is it's so deeply embedded, and it's really hard to look at the way we talk, the way we think. And I've run into a lot of people that say that, like, using different language to describe people who use drugs is like it's PC, or politically correct, or it's being too sensitive, it's being sensitive, or anything like that. And really, what I would love to leave people with is that it's really not about being PC. It's really just about recognizing that these are people that are affected by this every single day. This touches all of us in one way or another. It touches all of us. And really the only thing that it is asking people to look at a person and be non-judgmental and to use neutral language. So like some other examples, addict, drug users, IV drug users, using people who use drugs, or a person who uses drugs, and instead of saying a drug habit, a drug addiction, those kinds of words. Substance use disorder is a really great way to put that. It kind of takes away, takes a lot of the focus off and puts it more on recognizing this is a medical problem that has to get treatment. This isn't a willpower thing. People don't just you don't pull yourself up by your bootstraps when it comes to an opioid.
Bootstraps if you ain't got no boots, right?
That's exactly it. That's exactly it. I love that. Referring to people as being clean, I understand it, but it also means that if they're using, then they're dirty. And it breaks my heart to think about people that use drugs as being that way, because I know probably how they started using, and it's pharmaceutical companies. So the only other thing
I call it addiction crisis all the time. I'm sorry, I didn't mean to interrupt. I call it addiction crisis because I heard from people that are working in the front lines of our communities in recovery. Paula don't call it the opioid crisis because it's broader than opioids.
And that's a really good and I've thought about that for a long time. That since we talked the other weekend, I've thought about that, and I'm like, for where you're at, it's accurate, because this is becoming so much more than opioids. It truly, truly is. So we generally, when I do any kind of destigmatization work, using overdose crisis or something like that, generally is received a little bit better if people are really, really against it, because we all have lost someone to overdose. But you're not wrong either in calling it the addiction crisis, because this is so much bigger than just opioids. It's becoming so much bigger, and the problems that we're seeing now, especially with amphetamines, it's a completely different treatment system. It's not Suboxone, and it's not a 30-day stay somewhere. It is even detoxing looks completely different. Treating it is it's a whole other world, and we have so much to learn as a state, as providers, about amphetamines. And so I think it makes a lot of sense to it is the addiction crisis. It is this is a huge problem. And then I think the only other thing, honestly, was just this whole idea of harm reduction. West Virginia doesn't talk much about harm reduction, I think, because of the stigma attached to it. I think people hear harm reduction and they think syringes. They're just, just to remind people, it's way more than just handing out clean needles. It's referral to substance use disorder treatment, screening, care, and treatment for viral hepatitis and HIV. It's education about overdose prevention, safer injection practices, it's vaccinations, and screening for STDs, and it's education about safer sex practices that really you don't find anywhere else anymore. It's abscess and wound care that not treated, those things result in hundreds of thousands of dollars in medical costs that could totally be avoided if it was just taken care of sooner. Naloxone distribution, so naloxone or Narcan is the opioid overdose antidote, and it's referral to social and mental health and other medical services. So all of that is in addition to just providing clean syringes. And the most important part is that we're not going to beat this addiction crisis with doing what we've always done. We're going to solve this problem with connection and with community and by loving these people back. So we've got to be able to understand, just making those connections, I think, is the most powerful tool that we have.
Yeah, we can't have a path up if we keep on beating down each other and with our throats. And it's an age-old tactic, divide and conquer. And, even when we talk about why don't they invest in insulin? Well, they're both life-saving, and it should be available to everybody. And one person should, this is a disease, and people, we need to be saving lives. We don't need to be devaluing human life just because somebody got sick. We don't stigmatize somebody just because they got cancer, because they smoke cigarettes, or, people here, they just get cancer because of where they live, or even people that live in food deserts that are obese, that don't have rural transportation, and they don't have access to fresh food. So they're eating things from the Dollar General and Family Dollar across our state. So our state's stigmatized because, we have high rates of diabetes and obesity, and we have to look within ourselves. And West Virginians are some of the most hospitable people in the world. I've been around this state dozens and dozens of times and met with all kinds of people. And stigma is just propaganda. And I know West Virginians are better than that, and we can do better.
Here we are. I love that. Yeah, we are. Absolutely.
Well, Brooke, thank you so much for just informing us. And maybe we can do this again soon.
Yes.
If anybody out there needs, if you're an addict and you need help, you reach out to me. I know a lot of folks across the state that can help. My number is 304-894-7472. Brooke, is there any way anybody can reach out in the Charleston area?
Absolutely. SOARWV@gmail.com. You can email anytime. If you've got questions about harm reduction, questions about resources, even if you just want to talk, I'm happy to talk. And even if you don't agree with me, that's okay too. I got a lot of patience, so we can talk it out, and I promise I'll win you over. This is how we're going to come back from this.
That's right. We have to unite our fight, and we have to unite our fight against addiction. People are dying, and y'all, we have to take care of each other, and we have to quit with this stigma. It's not going to end as long as we think that we act like we're privileged. None of us are privileged. This is one of the sickest and poorest states in the nation, and nobody's better than anybody else. And just because you're downtrodden doesn't mean that you don't deserve a path up. And this is what this is about, is making sure that West Virginians have a seat at the table and we survive for a change. And it's going to start with us. We are in the fight for our lives. And there's so many things that we can do right now. And first and foremost is be good neighbors and be kind to one another.
Sure thing.
All right. Thank you
so much. Thank you.
Have a good night.
You too.